Hi guys. Okay, I'm back. So last time we talked about neurotrauma nursing, and let's talk about this time. My second job as a nurse was home care nursing. I chose home care nursing because after working neurotrauma, where I was working nights, working home care, I felt like it was going to be a lot more flexible with my life because my kids were like in kindergarten and first grade, I think, or first and second, I can't remember because it's been a few years, several years, since my kids are adults now. But so I decided to switch from neuro to home care because I felt like it was going to, again, be much more flexible. Now, my specialty when I was doing home care was post-op CABG patients. So these are patients that just had open heart surgery, and so these are most of my patients that I had. Where I was working, and this is in Michigan, on the west side of Michigan, the one and only time I worked in a nursing union. I'm not a union fan, but it's okay. We're not discussing that right now. This is not a positive or negative of unions, but as a union nursing home care nurse, I had a maximum of five, basically what would equal five patients a day. Now I'll tell you that the physical therapy and occupational therapy employees that went to the patients' homes were not in this union. So I was kind of lucky, except that my husband is very not for union, and so it was very hard for me to do this and have to pay the union fees. The pay was a little bit less, insurance was a little bit less, or actually was a little bit harder to get, or as far as my premiums cost more, even though it was the same company that I worked with. It's just a different entity when I was working in the neurotrauma unit. Same company. I'm not going to name the company, but you know, same company, different entity. So different insurance, different benefits, blah, blah, blah. So, as I said, my patients primarily were post CABG patients that were home. So, for the most part, what I would do is admit the patient to our service, and that includes doing an EKG, which you would bring to the home, vital signs, a full assessment, knowing what kind of medications they were on, blood draws, possibly taking staples out and assessing any wounds that they might have. A lot of times they were on blood thinners too, so you're doing, again, just blood work as well. A lot of times, so I think these patients, if I can remember right now, this is, we're in 2019 now. This was 2006 that I started this position, and I think I only, to be perfectly honest, even though I really, really enjoyed my patients and I enjoyed my work, it was the most stressful job I have ever had, ever. And let me explain that. The reason home care was so stressful for me, I was only a nurse for 9 months. I have at the time, a BSN. currently I have an MSN, a master's in nursing, but master's in science and nursing, blah blah. At the time I had a bachelor's. I was 32 years old, so I had some other experiences behind me, a family, children. But let me tell you, at that time, it probably wasn't the best job for me. I feel like from the first day, from the day I left my last job until 2 jobs later, my anxiety was so high. Like my heart rate was always like in the over 100, usually in the 120s. I remember the last night of my job prior to my first day of my home care. I remember I was working nights, and I was working in a neurotrauma unit, if you watched any of my other videos. So I was working nights there. I remember sleeping on the couch because my kids were little, and trying to sleep on the couch because they were home for some reason. I don't remember what time of year it was, but for some reason the kids were home. So I was sleeping on the couch, and I remember waking up like I couldn't breathe. And all I can say, and again, I loved home care. It's just that the anxiety from the responsibility that I had for my patients was so high. From day one, I was the case manager, case manager, and my patients, like I said, were post CABG patients. Every single morning, I worked 5 days a week. And from the time I woke up in the morning, I would listen to my voicemail, and I would have, 10 voicemails, like orders from doctors or things from the home care agency. With home care, if you're the case manager or the care manager, you can have somebody help you, like an LPN help you, or you might have like an aide that helps, but you are basically responsible for that patient. I guess at that time it was just something I could not handle, and even though I loved my patients and I loved what I did, my anxiety was so high all the time. I didn't sleep well. I remember going to bed, laying in bed, I could just feel like my heart was pounding all the time. At that time, they shouldn't have hired a new nurse. They hired me because I had a BSN. I was certified in my EKG readings. I was so happy when I got hired there, but they probably, to be honest with you, should not have hired me. Because I just didn't have the experience. I think now I know that I'm sure, I shouldn't say I know. I'm sure now I can handle it and I would do better with it, although the pay was a lot lower. So let me tell you. So like I said, I would go to the patient's house. For the most part, I only went to like the office to pick up for meetings or to pick up supplies. But otherwise, I worked from home, and for my patients' houses. And that was so flexible. It was such a different experience for me. But let me tell you, it's nice to give up a patient when you can at the end of your shift. So I would go to a patient's home, and we would get to know each other. I would admit them to our service, do an EKG, do an assessment, do their vitals. After, I don't know, I probably not immediately take out their staples, but they usually would have staples like here, and then maybe they would have like, okay, I'm pointing to my leg. So a lot of times they have an incision here, an incision here, I think an incision here. So it's kind of cool because I used to have okay, I'm going to point to my leg again, but they used to have like a line down their leg. So it's improved a lot. It may have improved even more. I'm sure it's improved even more since I have done post-op CABG home care nursing. I don't know. Maybe they don't have any decisions anymore. I don't know. But anyway, I you know, it was nice because I could get my kids off the bus, and honestly, sometimes I would have to take them to the lab and drop off labs, because I would draw labs on patients. The one thing I have to say a couple things I did not like about this position. Or something I learned from that position. I was not really great about charting everything at the patient's home. I would write things down and then chart at home. I had a fax machine at home that would have faxes come to my home. It would have been a lot better if I learned to get all my charting done in the home. That is one thing I would totally recommend. Get your charting all done in the home. They don't care. They really don't care. Just get it done once you get really good at it. And then also something negative about it is that, the mileage on your car. Now, they loved me being there when they hired me, because I lived, the office was like in a major city, but I lived south in the country. So they were really happy for me to be there, because good, now all these city people wouldn't have to drive south all to the country area and have to put all these miles on their car. So, because I live there, so I was used to miles on my car, but there definitely was a lot of mileage put on my car. And yes, the home care does pay for mileage and gas and wear and tear on your car, but it would definitely be a negative. I really liked being able to get my kids off the bus and being able to work at nighttime if I had to, because nothing had to be in right away. But I remember because my husband is an engineer, and a lot of times, the two of us would be at the dining room table at nighttime after the kids went to bed. We're both working on our laptops, doing work, and trying to finish up our work for the day, and both, it's not just, I just felt like I was working all the time. I felt like my brain never, ever shut off. So, unfortunately, I only did home care for 6 months, but the good thing about that is that I went to my absolutely favorite nursing specialty, which the reason I went to nursing in the first place is OB/labor and delivery, and we'll talk about that with our next video. Come back.